Hello everybody, my name is Scott Christensen. I'm a nurse practitioner with Urology San Antonio. I've been with the practice for 10 years and today we're going to be talking about Peyronie's disease. I've been treating Peyronie's disease for 10 years and we've had lots of great success. So, what is Peyronie's disease? Peyronie's disease, or PD, is the development of scar tissue or plaque on the penis. This plaque or scar tissue can go unrecognizable for some time. Most men will seek medical attention when they notice a curvature of the penis, usually whenever they are erect. This plaque can restrict lengthening and sometimes cause an hourglass or bottleneck appearance of the penis. Peyronie's typically occurs in two phases. Active phase, that's the first phase. During this phase, the plaque is remodeling, possibly causing inflammation, pain, and deformity. This plaque is sometimes palpable, but not always, and this phase can last up to a year. After that, we reach the chronic or stable phase. After the acute phase, the plaque calcifies and remodeling is actually complete. The pain usually subsides and the deformity stabilizes. During this phase, the plaque is more likely to be palpable. Changes in sexual function may occur during this phase. So now what causes PD? Although the exact cause is unknown, it has been theorized that there is a genetic component. Dupuytren's contracture may be a risk factor as well. More commonly, it is believed that PD can be caused by a history of penile trauma, most notable caused by an injury during sexual intercourse. What are the symptoms of PD? Not all men will have the same symptoms. The most common symptom that causes men to seek medical attention is curvature or deformity of the penis. Other symptoms include pain with erection, lump in the penis, and/or erectile dysfunction. The penile deformity may prevent or make intercourse difficult. Now, how is a diagnosis made? There are really no specific lab tests that will test for PD. A complete history and physical examination of genitalia will be necessary, always done by me. This will usually involve measuring the penis while erect and assessing for any plaque. This usually involves an intracorporeal injection to produce an erection, which is done in our office. What are the treatment options? Patients should have an open discussion with their provider about how this affects their quality of life. Not all PD needs to have treatment. Often reassurance and emotional support is all that is needed. Some patients may actually have a spontaneous resolution of their PD. During the acute phase, the aim of treatment is to relieve pain and preventing further progression. Pain can be relieved by NSAIDs. During this phase, we do what we can not to make the symptoms worse, so everything is actually aimed at preventing progression of the disease. There are several different medical options for treatment. Oral therapies are our first options. These are the least invasive options. These aim to improve scarring and reduce plaque. Pentoxifylline is a medication commonly used in cardiac patients. Its goal is to actually halt the progression of your PD at the stage where it currently is. Now, I have to let you know this is not a cure or fix for PD, but very specifically to stop it or halt it in its progress. This medication is used to get patients into the chronic phase, at which we can be a little more aggressive in your treatment. Now, once in the chronic phase, we can use the medication called Xiaflex. Xiaflex is the first FDA-approved injectable medication for PD. This is an option if there is a curvature of at least 30 degrees and a palpable plaque. This medicine works in combination with penile modeling and a traction device. The penile traction device delivers steady traction to stretch the tissues, which can reduce the curvature of the penis. There are always surgical options, but I'm not always in a hurry to rush my guys into surgery. Men with stable PD who have been unsuccessful with medical treatment and have a curvature that interferes with sexual intercourse may be a candidate for surgery. These are the most invasive options. Tunical penile plication. I know that's a mouthful. This may be a good option if the patient still has good erectile function. Tissue on the opposite side of the plaque is sutured, shortening the long side of the penis to counteract the curvature. This will straighten out the penis, but as previously stated, can cause shortening of the penis. Our last option is a penile prosthesis. A penile implant can be implanted for severe erectile dysfunction. This implant will correct the curvature as well as your erectile dysfunction. So we here at Urology San Antonio look forward to hearing from you, and we are more than happy to be available for your Peyronie's disease questions and concerns. Thank you.